Welcome to another episode of the Beyond Limits podcast. On today's episode, we have Dr. Samarth, who is a qualified psychiatrist, accompanied by Pranamya, who is a psychotherapist, and Prithvi, the co-founder of Glass Onion Therapy. Together, they've built a space, Glass Onion, where care, compassion, and empathy are not just given, but they are built into the system. A system that takes care of you, not prescribes you. A system that is built with holistic care in mind. Today we discuss about depression, mental health, anxiety, and all things beyond this. A wake-up call that mental health can affect anyone and everybody. It does not mean you're too young, too old, or too poor, or too rich. Mental health is something that is universal, and just as we take care of our body, it is important that we give that care to our mental health as well. Hi, I'm Dr. Sharanya, a medical graduate and a certified physician with a master's in public health and also a master's in functional medicine and bioidentical hormonal replacement therapy. I have always believed that health is more than medicine. It's about resilience, mindset, and the human stories behind every journey. Welcome to Beyond Limits. This podcast brings you conversation with experts, change makers, and everyday people who have pushed boundaries in health, life, and science. From breaking barriers in medicine and science to redefining wellness and uncovering the untold stories of grit. Beyond Limits is about thinking bigger, living longer, and going beyond what people believe is possible. And if you'd like to work with me on a one-on-one or book a consultation with me, you can reach out via the link in the description at the email therealsharanya@gmail.com. It is therealsharanya@gmail.com. Let's go beyond limits together.
I think what I would like put it across as that it's a combination of what the patient presents with versus what kind of treatment he requires. I think it's not necessary that you start with a psychotherapist or a psychologist or a psychiatrist. It just depends on, at least you reached out, whatever is your first touch point. Make sure that the person who is, helping you with your mental health issues is well aware. That is the best thing to do. I think make a great choice in picking the right place to go to, because then the guidance will happen on its own.
Yeah.
Because, for example, the same example, if you went to some kind of herbal bone setters, you may not at all get the help that you wanted. In fact, you'll get worse. Is that the right way to put across?
Yeah, sure. Yeah.
I want to probe into that.
Some people like it also. Some people want to go to herbal centers. So just saying. Yeah.
Yeah, if you look at that analogy, Alcoholic Anonymous is that, right? Like,
Yeah.
It's not
Herbal
clinical.
center.
Yeah, it's not clinical or scientific.
No, but it's very effective
More
because
effective than.
it's based on like a very sound sort of formulation of dependence.
Yeah.
That's why it might look a little bit like off, but
Yeah.
Just we're not promoting it. We're not promoting it. Just
Yeah.
saying that.
yeah.
It is when you look into the evidence. Yes, it is. When you
You're promoting it.
let's talk about it in another.
My question to you was, so have there been instances when someone says, I want medication for this, but you find that the levels are subclinical and you say, you don't need medication, just go to therapy?
Yeah. See, the general consensus is that psychiatrists don't know therapy, or they see in a minute, and they are like, just like any other specialty of doctor, not being psychologically minded.
Yeah. I think that's a very common analogy that, psychiatrists don't have the time because they have a OPD waiting for them and they have to see the patients, because again, another contrasting thing in their practice is that your patients might not have the patience to wait.
True.
Because they are going through something and they want to see you immediately, right?
So that's a barrier. It doesn't mean that psychiatrists don't have the training in therapies. We do have good amount of trainings.
Do all psychiatrists?
Most good psychiatrists. So there is good amount of training that we get, but the constraint is mostly with the time, right? And also when you do therapy, it's more of structured. You would require a lot of understanding, going back, working on that, right? That's somewhere the psychiatrist wouldn't be able to do it. That's why we work in a team. Like an orthopedician would know, right, what physiotherapy should be done, which muscles should be focused on. But they cannot do it because of their own constraints. Same with us. The medical specialties in India have their own problems because of the the number of patient doctors ratio. That's why we need a team.
But now, like, unlike Glass Onion, right, where you guys are completely focused on offline therapy, wherein you have an entire team where your focus is majorly offline therapy, where you have a team of psychiatrists, psychologists, psychotherapy, and you have other modalities as well, nutrition, and you have hormonal balancing, and a lot more, right? But unlike that, now there's so many people who want to do it online. What's the actual difference like? Because for somebody, maybe that's accessible, but for somebody, maybe this is not accessible. Like, is one better than the other?
You have a take?
You go first.
It's different for sure.
She's done both.
Yeah. Yeah, I mean, it's different for sure, but I wouldn't say that online's been bad. Like I even in my training, when we've done residentials as opposed to training online, I felt that there's been a difference. But yeah, I feel like it's both, on both ends, it's been somewhat of something that you've been constrained into doing. For practitioners, where you spend a bunch training, and then you're probably not in a place to spend a bunch to rent out a place for yourself. Not everyone who's like freshly graduated is able to set up a physical space for their practice. Organizations and the way that works looks very different, and I don't want to get into that yet. For people who are accessing therapy also, to travel is often, and to like make something physically real is not always easy to do. And ever since it's been online, I feel like something about it has become more accessible. So I feel like that there is a certain sense of giving into circumstance on both ends, like for practitioners as well as patients. A lot more practitioners have been able to practice because there's been an online option available, set up because there's been an online option available. So yeah, and like for instance, even with this space, it's been possible because there's been a lot of focused effort capital wise, I would say. I mean, off the top of my head, that has gone into setting up this place, which is an exception to what's easy to do right now in this context. So yeah, it takes a lot more effort and to set up this. I know that's not exactly answering which is better, but I just want to, like, I feel like this is more important, how both of these ways of working came about, and that is why they're like conveying different realities of people who are on both ends. So it's very hard to like think of it in terms of, hey, you should do this and not that, and this and not that,
Yeah. So do you have something to add to it, Dr. Samarth?
So we know how online classes work and what sort of training we get online versus the offline. There's always a difference between the quality and what we get, and then how well we are able to concentrate on this, right? But yes, when it comes to mental health, and there's a lot of differences, right? Because of the accessibility, the cost, the travel, right? And a lot of tier 2, tier 3 cities don't really have mental health facilities. So online, kind of cuts across all those barriers, and it makes mental health more accessible. And certain conditions of psychiatry as well, like a person is having severe anxiety, right? Not able to go and reach out to a mental professional because of a lot of constraints. For them, online mental health services is a boon. Right? And also, when you take a person who's medically ill, a person who's having cancer, a person who's having, something terminal, online becomes very accessible and more, efficient way of, delivering mental health services, because offline is something which is impossible for them. Right? But offline, yes, when it is possible, I would prefer something on offline, because that builds up the rapport, that builds up, you know, the therapeutic alliance, the relationship that is there. So yeah, both of them have pros and cons.
Right. But that being said, you know, a lot of people who I know in this age group of 20 to 40 find it difficult to talk to their primary caregivers or their parents, their partner, about mental health, that they are going through this. And most of the time they have spoken about it, they're always left with the thought that this too will pass. Why is it, and how can they actually bring up these conversations in a more better way, or where they're accepted and
with their parents and families.
yeah. Because even the most educated or well-to-do parents these days may not get it that you're anxious, you're depressed, or, you know, they kind of see it as it's
A
just
failure
a
on
phase.
their part.
Yeah,
That's how my parents perceive it.
yeah,
That if I need mental health care, they perceive it as a failure on their part.
yeah,
The amount of time we are taking to think on this itself,
Yeah.
you know, tells that it's something very deep.
yeah.
See, I feel that there is no open communication that's being there.
Yeah.
Right? We always had dining table, you know, talks with our parents when we were kids, right? Where sometimes we used to talk openly, but a lot of times we always feel that there's a gap between their
There's a
understanding,
barrier,
a barrier. If I tell this, will I be judged? Will I be thought that I'm weak? Right? There's always this
Yeah.
thing that makes us stop communicating. That's why I think probably, you know, there's always this that, you know, treat your adolescent kids as your friends, be open to them, because of this barrier itself. So I think somewhere talking openly, I don't think it's, you know, as I said, they take it as failure from their part.
Yeah, like I don't know how right it is to put this onus onto us.
Yeah.
Like, you know, there needs to be that space for us to have that conversation with our parents. If that space is absent, then there's only so much we can do about it.
Yeah.
Yeah, I think that's why I was quite struck and a little bit lost for a bit when you asked that question about how to, because it almost felt like something that's unknown and that needs to be brought up like that. And something about it is so strange, that either the system that you're living in is quite oblivious to what your struggles are, what you're going through, or that in some way it's not just you. Again, it's the whole system. The symptoms might be showing up in one person, but often like they can be thought of as something that rests within the family. And so I guess, yeah, I suppose it is too up close for parents to kind of step back in the way that mental health professionals or like people outside of your family can maybe think and say, okay, hey, I see that you're going through this.
Yeah.
Perhaps different, because they're almost participants with you in what you're going through. So yeah, I was quite struck by that question about how do you tell your parents?
Yeah.
So even when we have a few people who come to us for therapy who are under the age of 18. Like, it really makes my heart swell when they have a solid support system
Yeah.
that's supporting them and getting therapy.
Yeah.
And I just want to ask you that. So, how do you feel, or how do you perceive it when, because you see kids as well, when they have an active support system for sending them to therapy?
I mean, good. Kids are always, kids and adolescents use up therapy space in such a different way. It's fun. They've got things to say. They've got things going on, as opposed to adults who had things happen and then they're staying with it. I think kids and adolescents are people who have things going on then.
Do they have the realization of what's happening? What is therapy? What
Not
is this
always, not always, but they have a very different kind of aliveness.
Right.
Because they are responding to their contexts and environments as they are also in therapy. So I mean, I feel like the work with them is quite different, and I feel relieved when parents are able to be like, hey, you go there, you be part of this, and you go be by yourself and figure it out for a bit without being too much like, hey, you go there to fix yourself, or like figure it out and come back, or whatever. Like just parents who are able to understand that, okay, yeah.
If anybody is wondering who's snoring, that's a dog. Study.
Stout?
Study. No, don't touch it.
Don't touch it.
Okay.
Stout?
Sam, let's go.
It's okay. It's like a white noise.
So, how do I perceive it? That every once in a week, I'm left with this strange person who's asking me questions that's making me think that
They're not that little
yeah.
also. But anyway, finish.
Yeah, but do they understand that I'm here because I'm going through something?
Yeah, I mean, I feel like that understanding is there.
Okay.
Maybe not a broader understanding of how mental health works and that this will make me feel better. I feel better right now talking to this person. That's my understanding. That's my takeaway. Eventually, I am feeling a little bit better adjusted to my current environment. That's my thing, but not so much perhaps a formed thinking of, okay, this is what happened, this is what I'm going in for, this is how it's going to help me.
There's a lot of shift also. These days I'm seeing kids telling their parents
Yeah.
that they come up with issues like, I've been having anxiety, I've been having depression, to a point where they also have come up with diagnoses like OCRDs, like obsessive compulsive related disorders, like trichotillomania, like skin escoriation disorders. So that much of awareness is there among the adolescents, and they themselves tell the parent that you have been suffering from these issues. I think you should get treatment for this. And the parents
Go to therapy.
Yeah, the parents come.
That blows my mind.
Yeah.
I never had that agency.
I don't want to comment. I'll keep it off the camera. So parents do seek mental health services, telling that my kid said me that I have these issues. I'm among the couples as well.
Oh, the kids suggesting parents as they go to therapy.
Wait, I didn't.
Even I didn't. Yeah, that's.
No, I thought he was telling it the other way around. That the kids telling that we are going through this, so take us.
Both the ways. I am going through this and you are going through this.
Yeah.
So both of us need to take treatment.
Oh,
That's the different
that's
development. I really feel happy when I see this.
That's so
Awareness
great.
among them.
That's so amazing. Parents get to hear like their kids saying, "Hey, you need to sort that out," and like go to therapy. That's cool.
Right, and then there's like so many different types of therapy, right? There's talk therapy, then there's somatic, then there is so many other different types. Now, how do you decide who goes where and who's that? How, like for example, you do not know these exist and you just land up at one place. Do you get referred to these different types of therapies? How does this space actually function?
Right. So we don't prescribe therapy on first meeting. It's more of better understanding of what patient has undergone. And see, therapy also has been devised for certain kinds of problems based on symptomatology, and there have been studies, there have been RCTs where they say that a person undergoing this form of therapy, like an REBT versus CBT for a particular kind of illness, right, or a personality disorder, and what works best for them, and that's how therapy has been devised.
Right.
So we start with, at Glass and we start with an evaluation, and then we have a basic understanding, and then we sit as a group discussing the presenting symptoms, the target issues, and then we devise after a few sessions of further understanding that what are the things that we need to clarify, and later on we prescribe therapies based on their issues and what they would best benefit from. And it's not always that we take a certain form of therapy. It's more of we call this eclectic approach, where we take different understandings, different inputs from different types of therapy, like which includes developmental, which includes the current issues focusing CBTs, right? And a person doesn't come to us with just depression. He comes to us with a lot of issues, like family, right? Other comorbidities. There is problems in attention. There is problem with prioritizing things, making things scheduled, right? Occupational dysfunction, emotional regulation. So many issues. So we cannot just take one form of therapy. It's more of a comprehensive approach, and that's where teamwork comes in.
Right. But do you have anything to add to it? Like, a lot of people like doing talk therapy the most. Is it because they're like at some point lonely in their life and they find their therapist to be that go-to person?
Shall I add?
Yeah.
Go on.
That you have asked the question that will I be dependent on therapy?
Yeah.
Say, please.
Can I?
Yeah.
So there's often this problem that people seek therapists whenever they have problems.
Yeah.
Right? So therapy was not devised like that.
Yeah.
When you take developmental form of therapies where you become an attachment, therapist becomes an attachment to the patient, which he or she was not having before. And you gradually have to make them capable of sorting things on their own, create that mirroring, right? These form of things among them, so that they are not dependent on the therapist. That's the ultimate goal of the therapy, right? Any form of therapy, you're helping them with the tools to understand and then go forth without the help of therapist. That's the end goal of therapy, and that's where once you are done with the intensive forms, then you gradually get separated.
Right.
The therapist frequency, the interactions, everything, and telling them how to sort out things on their own, right? So I would take therapy as a form of mirror, where you understand things, why it is like this, where it is coming from, and you start sorting things on your own. That's what therapy does.
I think that's brilliant, but I see a lot more people who are like, I've been in therapy for 3 years, 4 years, and is that how it's supposed to work?
It can work that way. I don't know. So there are two ways to look at this, okay? One is this really famous way of thinking was, hey, therapy is supposed to make you realize your needs and not meet them.
Yeah.
Okay. Yeah, that's one, and that's also weaved within the structure of, hey, this is going to be a professional relationship, and I'm not really whatever. But the other, and the one that I'm more recently getting acquainted with, and it's really making me think right now, is we're so awkward around this theme of dependence, over dependence and under dependence, and our own dependences, or what we might be coming to. And I very recently am thinking more of the idea about people need to experience their dependence being met in order to then, kind of switch on this experiential knowledge of how can I do it in other places with other people. Because somewhere that's the problem, or that's the issue. I'm not able to depend on people. That's sitting at the core of everything else that they're saying to you. So sometimes in therapy with some people, I've found that they need to experience that, and that can happen in various ways. Not to say that the structure, or that you as a therapist start to come across as this limitless resource that can be depended on in all times. That's not what I'm saying. But that the person needs to be able to sort of bring their dependency into the relationship somehow, and needs that dependency to be responded to in a way that's other than, hey, can you take this away, and like find another place that's more appropriate for it to be met. So like this is a more nuanced, so I'm still sitting with this idea, but like I think I've shifted from that to this, and it's brought up like a certain shift in my work as well, where I am less awkward with whatever, like just this general feeling of dependence that we all have. and have like feelings about.
Yeah.
So I have a question.
Yeah.
So do you agree that a person comes weekly to you and he stays to come weekly to you because he's not able to get out of that dependency?
I don't know what that dependency is, honestly. Like, what is that dependency? A person is meeting a therapy. By the way, if this is digressing, tell, okay?
No.
But no, I think it's how can a 50-minute talking to a person become a dependency as if it's a drug? Also, I mean, if it's unable if there's something that's happening in the relationship that's unable to be translated into the other parts of this person's life, which is, I suppose, the goal, then you need to like regroup and think about what's happening. It's not a closed system of two people exchanging something precious which doesn't go out. It's a skill and it's a practice that if you learn how to do here, and you're able to bring up your anxieties and your conflicts and your ill feelings or feelings that you thought are impossible to express, if you're able to like sort of try all of that in this relationship and get to the point where you're like, okay, I think I can do this now in real life, then ideally you will translate it. You won't want to close it to this relationship. And yeah, I feel like as a therapist, then it's your job to facilitate that. If you feel like this is becoming closed, and if I feel like I'm moving myself too much to, and this is again a very personal take as me as a professional, but there are certain ways that you check for that. I wouldn't say that that's a problem of dependency. Again, I would say that something is not being spoken about and put into motion and moved so that it can go into other parts of your life.
So you still tell that there's a closure, there's an end, or there is not?
This is such a long conversation.
Can I add to that?
Yeah.
Because from an external perspective,
Yeah.
as a facilitator of therapy, if I can say that, because sometimes I act as a communicative bridge between the clients and the therapist.
Yeah.
I get where you're coming from, but we also need to acknowledge that this structured interaction has bounds. It's not boundless, right? It can't, you are encouraging dependency when the client calls and says, hey, I need a session now, and you have a session now, unless it's a crisis, right? Or when the client is overstepping the predetermined structure of therapy and you are letting it happen. That's when you're encouraging the dependency of sorts. Again, if a client is coming to you in a structured fashion and you're facilitating that, and the client decides to continue to come to you, doesn't that describe the need for therapy from the client's end, which is the very purpose of therapy? And like she said, it's not a drug, right? So we're not encouraging any form of addiction towards it. Like we're not, it's not giving you something that you're not seeking as a means to keep you coming back to us.
See, I know the answer as a mental professional. I'm just digging into
So,
it
and
for
if I were to put it like in a structured loop, it's like you work out, right, regularly for your physical fitness and everything. So I think, could therapy be put in a space wherein it's like mental fitness and you need constant checks on it to make sure that you are at the same time performing at a level you wish to be performing? No?
I don't know. Like, yeah, go on.
I look at working out as moving your body in ways you normally wouldn't.
Yeah.
Right? Because you have certain expectations from your body and you're trying to achieve that.
Yeah.
So, in a way, yeah, like you are looking at perspectives, you're thinking in a way, you're entertaining thoughts that you normally wouldn't in your everyday life if not for therapy. So, in that regard, maybe, yeah.
But my point is that it is more intensive in the initial, but when you are imparting skills,
Yeah.
or every session you're learning something, right, that you're putting into practice. That's when the therapist and the client interaction should slowly fade, And definitely there should be posters, there should be check-ins, right? If at all some new concern happens.
Right.
And then again, the imparting of
Yeah.
skills.
I think that's a good segue to put it under and say that, it is a process rather than.
And there are different schools. So
Yeah.
there's no one process to therapy. Like even at class and when we try to put together a team, when we were putting together this team, we made a conscious effort to put together a team that's more likely to collaborate and
Right.
collaborate efficiently. In spite of that, it will be counterproductive to put a structure for collaboration, because that's trying to create a structure out of things that don't have a structure, and that ends up creating a fake structure where
Right.
it seems like, hey, there's a process to this, but underneath
Yeah.
it's still chaos.
Yeah.
And
I think-
that's where brain is, it's convoluted.
Yeah.
Right?
Correct.
It is not something that is very,
So is onion.
so is glass convoluted. It's convoluted. That's where the name comes from.
I think with that, being said, in our 20s, we're going through so much, right? Is it normal that women go through more than men or the other way around?
Very sweeping generalizations it will become. So it will become too sweeping a generalization.
Yeah, and
We need a
we feel
whole-
overlooked by that
Yeah.
statement.
Yeah. Today of all days, you shouldn't ask me this question.
But that's like a common thing, right? Like the opposite sex doesn't really understand each other.
I don't know, but in textbooks we have learned that it's more prevalent in women. Again, something that we read in textbooks.
Yeah.
But
It's like women are from Mars and men are from Venus.
What is
Or men are from Mars and women are from Venus.
mental disorders.
The other way, first thing, what to say? Like,
Oh, the other way? Okay.
ladies first.
Oh my god. you could have doubled down on this perspective better than that.
no, really? Are you waiting? I'm as again, my mind goes to history, which is that, well, because my understanding of mental health disorder is quite psychosocial as well. So suppose you see, at least at the start, you saw more disorder in women because of the specific socio-cultural position they were in. And because there was so much suppression of any sort of distress, there was so much performance that you had to put in. There were so many restrictions and inhibitions that you have, and I suppose you still do. And those are probably the reasons why. And I wouldn't say that men don't have those; they also do. But I suppose there are different kinds, and maybe the kind of persecution that this section of the society has been very different from perhaps I don't know. Perhaps very little to no persecution that men as a group of people has faced. So very different kinds of anxieties, very different kinds of circumstances and dynamics, which is why I suppose hysteria, the very common classic example of like just something erupting.
Yeah.
But like if you look at the context, it makes sense, right? Like if in the Victorian era, if you're not allowed to even inhabit your sexuality and your sexual impulses, and if it has to be distorted and all of that, it will come out as something like this. So yeah, again, that's what I think. That's what I feel like. The kind of social challenges that women go through are very specific, powerful, and different from men. Yeah.
But for a question like that, I would question the methodology of anybody who claims to have an answer to that. How do you quantify it? How do you determine it? Like there are so many
Yeah.
mental disorders that go unnoticed, never spoken about, especially in our culture.
In our culture,
Yeah,
yes.
so how there's no way to answer that really.
Yeah.
And I think, again, correct me if I'm wrong, do we need to answer that question? Or do we just look at individuals as individuals?
I think it's better to look at individuals as individuals. The reason to ask this question was also that there is this generalized statement that women have some problems, men have some problems. While unlike the physiology, the mental health is something that's very different and very vast, I think. And everybody can have a problem and it's okay to have a problem, right? Rather than saying that women have more of these issues than men and kind of separating the both sexes.
Yeah.
No, but you can't overlook the experience of being a woman
Not overlooking.
when you're talking about mental health.
Yeah.
Is what
Yeah.
I'm saying.
Yeah.
But we were having this conversation the other day. It's fascinating how the experiences, the cultural, the kind of culture you're subject to, all of those could be so different.
Right.
But the way your mind adapts has a pattern. And that I think was very fascinating. So that's why I was saying, regardless of what the causative factors are, when the adaptations are uniform, you need to look at these as individuals.
Yeah, 100% agree. Like, for example, in our culture or most Indian homes, boys are told to rebel, right? Or it is okay when boys rebel and they make a noise out of it or whatever. Whereas in most homes, girls are said, it's okay, you need to adjust and move on, right? So I think, like you said, right, the way people have adapted in both the sexes may be different. But again, the contention is that they're equally susceptible.
Correct.
Yeah. I would add on this, taking from a doctor's perspective, right? Certain illnesses are more prevalent in female populations, right?
Yeah.
When you take hormonal, problems like thyroid disorders, right? They are more prevalent, and then
Yes.
estrogen-related, the fractures, right? When you take the post-menopausal
Yes.
illnesses, so there's a biological, perspective vulnerability. Along with that, definitely when you take it to with respect of mental health, when you take the history and the current issues, both of them have a role to play, and then it comes out in different ways. But yes, men also have a lot of mental health issues. We often talk a lot about women mental health,
Yeah.
right? Yes, I definitely agree that we need to focus on that, but there are definitely a lot of psychiatric issues more prevalent in the population, with regard to men as well. So there are different causes and different vulnerabilities, different situations that make each of the person vulnerable. So rather than an entire population, taking them individually, as I said. Right.
Yeah, I think more of an individualistic approach, because the reason was that you usually put women at a higher pedestal when it comes to mental health. There's a lot more talk going on in that direction.
I'm not sure.
I mean to say, at least in conversations when we are talking, promoting,
Yeah.
the more subset are promoted towards women. I wouldn't say higher pedestal. That's a wrong this
Go
thing.
to therapy also more.
Yeah.
Yeah. Also, how many therapists are you see the sex divide in
Yeah.
the
And also
working
more
mental health
women
professions as well.
take up the profession than men.
Yeah.
Like psychiatrists,
Like
it's
whole of
usually more
Glasgow,
men who
man.
take up.
Whole of
I-
Glasgow is just us.
Two
Yeah,
men.
you
And
have
stout.
the whole of male population of Glasgow here in this panel.
We both and the stout.
Yes, sir.
So the other day I was going to give a workshop kind of thing in a psychology college. There were two men, two boys, and just around 80 were women.
Right.
So that's a population divide also among the people
Yeah.
who take the mental job. Psychiatrists, I am seeing a shift in that as well.
Yeah.
The old days, the professors who we used to have were mostly men, but these days, I think with
The
respect
shift is happening, yeah.
there are some men predominant specialities
Yeah.
in medical.
But I think now that whole
is-
restructuring is happening, I think.
Obstetricians,
Yeah.
Wait,
lot of-
is that a thing in medical as well? I
Yeah,
thought it was
yeah.
only in engineering.
Like ortho is a male
Oh,
dominated.
is it?
OBG is a female dominant
Female
department.
dominated.
But
Yeah.
lot of my friends, lot of the percentage of men in the woman predominant job also increasing.
It's increasing now. It's slowly changing.
When you take the other, why just in medical? When you take some other jobs as well, like drivers, right? Certain jobs were mostly gender.
Male. Yeah.
Yeah,
But that's changing.
that's such a long like that's because it's a very nuanced conversation, and I'm like holding back from saying anything because there's so many variables to to why more women therapists.
Yeah.
What?
We're going to wrap up here in appointment.
Yeah. How do we wrap up? Do you have any more questions to ask?
And that's why I had glass onion therapy. We do. You were gonna
I
say.
think you tell that we'll talk about this in further podcasts and then something like that, so they can close. That's just what to
She doesn't
close.
want to
How
do
to close.
any.
Yeah. Bold of us to assume she's going to invite us again. She's leaving the country next month.
So that's the end. Lot of things to talk about, but let's not talk about it.
If you give me tickets to come back, I don't
Our
mind.
time is up.
If you're saying you book my tickets, I'll come back. No worries.
That's your 1 hour.
But anything else
Ticket
that
is
you all
not
want to discuss on it, or do you just want to wrap it up?
Yeah, let's get beer next time.
Okay, great. So I think it's been like a wonderful conversation on different mental health aspects and the way we see it. And I think I've been able to get like a perspective from a psychiatrist, a psychotherapist, and somebody who's into mental health and wellness as a business, right?
Yeah.
So I think that's what Glass Onion does differently here in terms of how y'all are structuring the therapy, how y'all are able to work together. Because at the end of the day, the client or the patient is able to see that difference, right? So with having said that, there are a lot of nuances to therapy, and I'm sure in 1 hour we can't really discuss each and everything. But
That's what they tell our clients as well.
yeah. But I think it's a great start to, having panels like this where we can have opinions of professionals who work together.
Yeah.
Yeah.
Also, if you hear snoring again, this time it's Samarth.
No. It's out again.
So I think thank you guys for taking the time out and actually being able to discuss things that most people don't really put out, as a part of, being in the space of mental health.
Yeah.
Yeah, thank you for this. It was a lot of fun.
Yeah.
Thank you.
Thank you.
That was great talking.
No, this is a lot of fun because these are perspectives like we wouldn't normally discuss in our work setup.
Yeah.
It really helps to know how we perceive our work as well and
Yeah.
how we approach our work. So
This was a think out loud kind
Yeah.
of session.
Yeah. I think that's what all of us felt because there were moments where we were able to pause, actually think and
yeah. The camera crew made us pause once. Thanks to that. Awesome.
awesome. Great then.
Great.
Thank you.
Thank you.